So you're saying we're hating because your throw game's wrong.
It's wicked cool.
Throw
When you put
dope.
it in, then you can goggle at the same time. Then you know you're a king.
Nigga.
I'm gonna
Throw
cut off.
dope.
Talking nonsense.
Okay. 10 reasons your dentist probably hates you too. Okay, the first thing you say when you sit down in my chair is, I hate the dentist. I've mentioned this. Too many patients have done this, and it's not nice, okay? We have feelings too. Also, I don't like you either, so
You just do
whatever.
your job.
Yeah. It's not like I actually want to be there. You don't want to be there, I don't want to be there. Number 2, you come to your appointment and it's obvious you haven't brushed your teeth in days, which happens more often than you would think.
Days.
Yeah, you have patients coming with like a hectic clock. Or the worst is when they come for a scaling, like a cleaning, and they haven't brushed their teeth that day. And it's like, okay, now I can see the supper that you had yesterday, and it's all clock and pieces of chicken, and now I have to go in there with, oh gosh, with a scaler, and then I have to floss, and then it's this
But I've seen it in most medical doctors like that. Most of them, seriously.
stressful life, man.
I think it's that like they're so stressed and they don't clean their mouth because on call and blah blah
I
blah.
gotta do quick.
Yeah, and they reduce self care.
Why?
No, I've never had this talk before. But okay.
So yeah, it was.
Yeah,
I took it personally.
You took.
Yeah,
it's a dentist to take a picture.
she's a stranger, but I took it personally. Okay.
How dare she?
You tell him, like, hey, I'm a dentist. You should floss.
She asked me, "What am I?"
What am I?
And I said,
A person.
"I am a dentist."
Oh,
Yeah. So proudly. No, I was like, "No, I work in a hospital."
ginger.
To focus on the teeth to notice the.
It's a ginger. She's like strawberry ginger ears. She's so cute. She's so pretty.
She's cute.
She's so pretty.
The way she jokes is actually the reason why.
She has a funny job.
She's got a funny job.
She's always at the trademark. Sometimes
Yeah.
she comes in, she does the trademark, and then she gets a call and then she leaves. So that's why I thought, oh, she's probably a doctor. Because who else is coming to the must be a consult doctor.
Chelsea with.
There was none. So anyhow, I just said no. Since I saw you at the gym, I'm gonna throw something at you.
Stefan. I'm so. Just
No.
no. 8-pack.
Yeah.
Dude, it was literally just coming out.
I would do that all the time. I'll just be like,
Oh, were you wearing my slutty shorts? Then you flexed your thighs.
I actually was wearing a really nice shirt. It was it was tight, just nice and short.
You must wear your slutty.
No,
shorts to
not that
Especially
one.
when you have to
I do on Mondays because it's leg day, and then when
You
things are
whore.
perfect, pop.
Oh, when you do the squat, you just like poke it out of the window.
But you have to poke it out when you squat.
Yes.
It's form.
That's my
Keep your
goal.
form. Anyway,
With those short shorts.
no,
Just look back when you like.
dude, let me finish this freaking stuff.
so you said you got approached. You were
No,
just
no.
minding your business,
I was going out
doing your thing. Huh?
like a princess.
Um,
Right. So I was going out, and then she just came in. Like we met at the door. So in the end, I just told her, yeah, I work at a hospital and I work there as well. And I was like, "What's your name?" And that's why I can't remember her name. I was looking at her teeth. Jeez. Anyways, yeah.
Did you get a number?
Let me finish.
Oh, that's what that was it.
No, because I was just going to say it, but you people keep cutting. It's literally not that interesting. It's not interesting. It was literally just came in, "What's your name?" Yeah. And then she asked me, "What's my name?" Yeah, "What are you? What do you do?" Who cares? Whatever. Then she asked me my name, and I told her my name. And I was like, "Okay, anyway, nice speaking to you." She's like, "You as well, we should do this again." I'm like, cool. And I left. But no, I didn't get her number because I literally was going to my car. I didn't think of that.
Yeah, that doesn't make any sense.
But I've not asked for people's numbers before. This is not something that's norm to me. I speak and I assume people are nice and I walk away.
But how are you gonna get to know her?
I say hi again in the gym. If I see her, if I don't, I don't. Plus, it's ComServe. It's 2 years. Sorry, 2 months left.
Are you gonna take her?
Why was I planning that?
She's a cute
It
girl.
must be fun being like pretty, right? Because you just have people approach you and you just act dumb.
Dude, my car was there. I was going to my car.
Okay.
There's nothing wrong with just speaking to people. And if she wanted my number, she would have asked for my number.
You're the man. You're the man.
She said, "Let's do this again."
She's just nice.
No. Because if I'm not interested, don't speak to me.
If I'm not interested, I'll be like, yeah, sure,
Okay, bye.
cool. But she said, "Let's do this again." Nigga,
Just
like
ask for a
really?
number. Hey.
If I see her 3 times in a row, if we
Oh,
speak more than
what's
3 times, I'll ask for her
No,
number.
it's not how to.
I'm not going to ask for somebody's number on first go when I literally was just leaving the gym, sweaty.
It's not the first go. She's seen you at gym. You've seen her at gym.
Yeah, but this is the first time we've spoken.
Yeah. So to speak again, you ask for a number. Is this? I feel like this is quite simple.
She basically.
It's a linear thing. It's a linear thing. If you're interested, want to give a number, you just ask for a number.
So next time you see like, we said we'd do this again, but I forgot to
ask
get
your
her
number. Yeah.
Just have to ask her what her name is again.
No, you can't.
When you get her number, you give her your phone.
Yes.
She'll save her own number.
Yes. She'll put in her name in. And then when you get her
Then I
number,
won't be able to remember because, like, what was your name?
it was with a D. You just go through your list. My goodness.
How many people do you know who starts with a D? Nigga.
You can go through my phone. It's like, Doctor this,
You
this,
give her
this,
phone,
this.
you can even call her. When she puts a number in, call her and say, hey, now you have my number too. We'll get in contact. When you get home, after you eat, whatever, send a text, hey, it's me. Do you want to go out this and this time and this date? There you have a date.
What's
It's
the second list? Second reason why people hate dates.
That's how you get a date.
But I wasn't looking for a date.
That's why you're single.
And moving on.
Sorry, I had to that's it.
So what?
So exhausting. That was so exhausting.
Go on.
Number
Jeez.
3, after we spent hours of meticulously repairing your teeth, you complain about the bone. Ouch. The comment from the dentist here says, would you walk out of the grocery store with a bag full of groceries and expect not to pay? I've just helped you continue to smile and eat comfortably. 2 pretty valuable things that help your quality of life.
True.
That gets to me.
Do people complain to you?
About what?
Yes, but like,
The price.
yeah.
No.
Oh, not to hit. Give me the head.
When we start off with a quotation,
Yeah,
and everything is there. So if you're going to complain about the price,
don't.
you can, but you'll probably be complaining to your spouse or whoever you came with just to vent. But what I also was told in one of the conferences is you're not selling the product, you're selling their happiness. Let me explain. I'm paraphrasing. So if somebody's going to come and be like, I want teeth, false teeth, for instance, versus I want to be comfortable in smiling, able to eat, and to talk properly. That's 2 different things. So now you're selling them expectations of a better life versus the product. So when you pitch the thing now, you're like, okay, we're going to give you false teeth for the teeth that's missing. You could be like, we're going to give you the ability to eat, talk, and smile again. But what we're going to do is going to cost this much. So it's up to you if you can afford this. If not, we can go for a different plan. But the whole point is to make you comfortable again. So when it's turned around, it's not more like you're giving them this product. It's not like you're giving them another chance. And it's up to them to decide if they want to afford that or if they want to be as they are. Then it swaps everything around.
This is marketing.
It's marketing. Yeah.
Number 4. I tell you that you have a cavity and you need a filling and you wait months or even years to get the necessary work done. Eventually the tooth starts hurting, 2 weeks of pain go by and you call me on a Saturday night while I'm at dinner with friends because your tooth that needed a filling a year ago and that started hurting 2 weeks ago is suddenly an emergency. And they expect you to still fill that tooth in, and there's probably like a cusp left.
I don't know why they have your number. Okay.
Some dentists list their personal number for emergencies.
Yeah.
What's an emergency dental? What's a dental number?
Another way to make money, because everything is literally supposed to be during office hours if you were informed.
Yeah.
Full stop.
Maybe Max Facts is like a dental number.
Yeah, because that should be it. Yeah.
Yeah.
I was going to say something, but it will come back again. I kind of digressed. Oh, yes, got it. I'm not sure if it's on your list. So I saw a patient recently, as in, excuse me, where'd that come from? Because I was opening my mouth and talking, and it just came back.
You said something about it's the leftover.
Yeah, all the gas bubbles are coming back.
Oh.
So this patient was from Muscle Bay. Well, they say they travel in between Muscle Bay and back. And they have a dentist that side. So the dentist had apparently done a restoration over a crown because the crown was broken. It's possible to do that now with different materials, zirconia materials, and that is all the materials I've got now in the practice. We've moved to zirconia. Zirconia is a type of metal, but it's an aesthetic metal as well, so it's put in the resin restoration, so you can build on a crown now. Anyways, so the lady comes in with her son, and the issue now is she assumes she's got pain on the upper right first molar. So, which is the third tooth from the back in the mouth. If you just feel with your tongue, 1, 2, 3, third from the back.
I'm stuck on assumes, but okay.
Okay, sure. Yeah. I use the word assume. I'll explain why. The reason why she assumes it's on that tooth is because that tooth is broken down. The crown was placed there, but she's got a root canal and she was not aware of it. So now, hence, you cannot necessarily, you could still have it if a canal was missed. True. Mm-hmm. But now, the patient had been injected on that tooth and prepared for me to start the restoration. I took an x-ray and I realized that there was something growing on the 4/8, which is the lower last molar on the right hand side. So there's a slight lesion growing there, and it looks as though the lesion is affecting the bone. So when she was injected, now the nerve should have been anesthetized and there should be no reaction to pain while busy on the molar on the top that was broken. I start off, as soon as water touches a tooth in her mouth, she has massive, intense pain that she has apparently been feeling throughout the whole day, and that's when she came to the practice. So, in the end, with the x-ray, I see no, she definitely has an issue on the bottom last molar on the right-hand side. But now the dentist had told her that the previous dentist in Muscle Bay, had told her that she just needs to keep refilling that tooth until the crown needs to be done on the upper molar. She'll eventually get a crown later because this crown was broken and he just kept filling it with zirconia restoration. Anyways, so the son comes in and is like, can I call the dentist in Muscle Bay? Maybe he's got some information that he might be able to tell you, or you can both discuss something because the mom is in pain. I was like, no, it's irrelevant because I've got the x-rays now. I see what the cause is. And to have a dentist on call for emergencies is irrelevant in terms of the dentist side. It's just there to make you feel good because the dentist needs to actually see the patient. So if that patient had come to me over the phone and just say, I've got a broken, patients don't know what root canal is, and they're not always aware that it's on that tooth. So I've got a broken tooth where the crown is fractured on the upper side, on my right-hand side, and I've got severe headache. What can the problem be? First thing you think of as a dentist is, it's the tooth that has the fractured crown. Restore it. But when you go to a dentist that has the x-rays and the patient in front of them and is doing the testing, you can actually see that no, the issue is not that broken crown with the root canal. The issue is actually what I see on the x-ray, which makes sense. So having a dentist on speed dial for emergencies, doing consultations over the phone, is just a way that the dentist can make money and make the patient feel good, but it does not actually help the, the issue itself. So with that one, why dentists or why patients hate dentists? With that comment, I'm like, if only dentists, it's only patients now. Let's go on.
I'm a growing baby. Whatever naps I can get. Okay. Number 5. Sorry. You come to me so that I can help you, but you make it hard for me to do a good job. You wince and make faces when it's not hurting. The idea that I'm hurting you makes me just as uncomfortable as stressed as you are. If it hurts, please tell me it's true. And I can help you with that. But if it's because you don't like the whole experience, you're only causing me to work in undesirable conditions, making it harder for me to do my best.
Pause. Were you under the impression
that we like hurting people?
Yeah. Were you under the impression they were like, take it, just take it?
I not necessarily like that. I just assumed it was that is part of the job, basically.
Like desensitized, right?
Yeah, and it is something that happens when you're in that. Like, I know when I'm doing range of movement and stuff on someone, they can be pain. So I know it's gonna come. So I'm not like too like. Of course, I'm like sorry for that, but like I'm not. Okay.
Well, that's different.
Continue.
When you're doing this, you're not numbing the nerves. You're actually working with a live patient. So with ours, we numb. The purpose of numbing I mean like live as in not anesthetized. It's live. It's not numbed out. So with us, the purpose of the injection is to stop any pain. Pressure still goes through if it is a big procedure. But if we're doing a restoration or we're doing a smaller thing and then you're like moving and making all those noises or praying to God like, oh my God.
Oh, they do that.
They do that. Then it's like, yeah, and I was the answer to your prayer, so sit still, But we still have things that we put in place. Like if you feel in pain, put your hand up so I stop.
Because we don't want you to feel pain.
Yeah.
Nobody wants to hurt anyone on purpose.
This is more like a venting session, but yeah.
This would suck. Where was I? Oh yeah. And when you push your tongue in the way or you don't open wide enough, it makes it physically impossible to get my job done. Don't you want it to be easy for me to do the best job for you? Speaking of patients who push their tongue in the way,
that sounds hilarious.
It's not actually. First of all, they do a lot of licking, and then the tongue. They do. It's very icky.
Fingers?
Suck on them fingers.
They lick
They do it.
It's so. Also, the tongue is a very strong muscle. So now I'm busy fighting with your tongue, and it's so annoying. But last week we had outreach, and my colleague was injecting, like she was extracting, I think it was a 2-7 or something, and he kept on putting his tongue there. The funny part is when she went to go extract, he pushed his tongue up and to the back, and he was busy complaining that he couldn't breathe because of her.
So he gagged himself with his own tongue.
He gagged himself on his own tongue, like, I can't breathe. It's like, nigga, put your tongue down. And also, what happened to your nose? You call and say my tooth didn't hurt before you worked on it. You came to me with a cavity. I did not put it there. You did. I'm simply fixing the one hole that was in your mouth. To do so, I must use a tiny drill to cut the rot out of your tooth. If I took a drill, cut a hole in your femur bone, and then filled it with foreign material, don't you think it might be sore for a while? Same concept. That's also another thing that a lot of patients don't understand. That fillings, even extractions, is not like a quick fix. Number 7, when you try to take an x-ray, or when we try to take an x-ray, you won't bite down on it. We have to do this to see what is going on with your tooth. Without knowing the problem, we can't properly treat you. I know in some cases some people really can't do it, but some people could and just won't stick it up for 15 seconds. I've had x-rays too, and they hurt and dig into my gums, but I just do it. Just. What is gagging?
Wait, hold on. What type of x-rays? Because the only ones that I can think of that digs a bit into the gums, yeah, are the intraoral ones, so the periapicals and the bite wings. But it shouldn't. It might be that the plate is a bit too big, or the sulcus of the mouth is a bit too small, or the positioning was off. But ideally, it should just sit in there, or you can either hold it or use a holder. But it shouldn't pinch. Yeah, no, that dentist was wrong on that one. For 15 seconds as well. It's like 3 seconds.
Yeah,
no.
15 seconds.
No.
How far do they have to walk?
Bruh. True.
For 15 seconds. Yeah, that is pretty long.
Yeah.
You tell me that you bought my car for me after having a crown done. Contrary to how it seems, you actually didn't buy me a car. You bought yourself a crown. I've spent hundreds of thousands of dollars on an education and spent hours making this crown fit precisely in your mouth. So maybe you helped me make a tiny portion of a student loan payment, but you certainly didn't buy me a car. I've heard a version of this. I've heard a version of this in government where you have, which like, apologies to anyone who receives free medical care from the government, but then they'll be like, "Hey, my taxes pay your salary." It's like, when was the first time you ever paid taxes? And do you understand how much tax I pay? I pay my own salary with the taxes that I pay. I pay a lot in taxes. Number 9, you no-show an appointment or cancel last minute. Some things are unavoidable, but when it's because your hairdresser got a last-minute cancellation and you had to take that appointment instead, this is just rude. Not only am I unable to fill the 2 hours of my schedule that I reserved specifically for you, but someone else who wanted to get in had to wait 2 weeks for his or her appointment. And on that note, when you have the first appointment of the day and you show up late for your appointment, I am late for every other patient the rest of the day.
Fact.
I mean, patients really don't get there.
No.
Especially in public. Because the way they will just show up.
Whenever.
Your appointment was 2 weeks ago. What do you mean? That's happened before. And I was like, what are you doing here? And then she doesn't even have an answer.
2 weeks ago.
2 weeks ago. There was a lady that, guys, on Monday, I went to my clinic. Lady comes in. I've seen her son before for burns. So he has, I think it was, I can't remember the percentage, but basically his facial burns on his neck, on his hands, both left, right, and his left shoulder and chest. So it's quite extensive. Last time I saw them was months ago. She didn't come back. She didn't show up. She knew I was at the hospital. She knew I was at the clinic. Now there's contractions. And she...
All of a sudden she remembers the appointment.
No! She went to the nurse to complain about something else. Then the nurse said, no, you have to go to physio. Then she didn't go to physio. She sat in front of me and she was just like, the nurse sent me here. And I was like, what must I do? What must I do? You didn't come back. And she was just like, yeah, I did. So she was saying, I was like, okay, did you do your exercises? Did you help him? Because it's a young boy, he's 10. Did you help him with exercises? No. So, ma'am, what do you want me to do now? No, but we did do the exercises.
You didn't.
If you did, we wouldn't have contractions. Oh, it was so frustrating. I was like, don't lie to me. It's okay. I can already see. And then I told her she's negligent. And if she does this again, she'll go to the social worker. Because it's dangerous. It's on his chest. It's on his neck as well. Oh, it's bad, guys. Oh. Sorry.
Number 10. When I tell you that you grind your teeth, you deny it as if I'm accusing you of having a horrible disease or being a baby murderer. It's not that bad to be a tooth grinder. I'm just pointing something out and maybe offering a way to prevent more problems in the future. This observation is concluded from signs or symptoms that are based on real science, not myth. Along those lines, bonus number 11. You tell me a diagnosis I make is simply wrong without listening to me. If you know so much, hey, Dr. Google. If you know so much, why are you coming to me you do the filling or root canal yourself. You obviously don't need me. I have a story about with this on mind. Whoa, what doctor said a guy I know. There was a patient, it was grossly curious, I think 26, 27, something like that, like literally no crown. It was like a cusp lift or something. And he wanted, you know, Instagram and TikTok. So he wanted us to build it up, which we will need to do endo and then like a post and core, like extensive post and core, maybe even a gingivectomy just to try and get some sort
Crown
of like
lengthening.
crown lengthening. He was on the basic plan. Yeah, the medical aid. It's going to be, how do I say? It was not within his means.
Oh.
What he was looking for. So I gave him the options, but then I was like, for me, for you, what I would see would work best for you is maybe like an extraction. Let's wait for it to heal. We could try a bridge, but with the way your bone is set up, I wouldn't go for that. Rather just go for
Where your bone is set up.
Yeah, rather go for removable because oral hygiene was not exactly the best. Like, heavy smokers, bad OH, all of that stuff. And then he was like, I could see maybe he doubted me. Maybe I looked like I didn't know what I was talking about. And then he said, no, I'll go to my other dentist. He'll fill it the way I wanted it to. I was like, fine, go to your other dentist. And chances are he's either going to tell you the exact same story I told you and extract the tooth and you'll get it removable, or he's going to do it. But if he does it, just know that he's doing it for money and to keep you quiet because he was very loud, obnoxious, complainer like. So he went to a doctor I used to know. The doctor he used to know did do the filling, but guess what happened 2 months later? He had to get the tooth extracted anyway. I wish I had seen him so I could just say, Mara, I told you so. Told you so. Because I don't know. I don't know. Is it? I don't know. But yeah, I just.
What the patients see on social media can be done. It's not an issue. It's just, are they willing to put in the finance and the effort and also to increase or improve their oral hygiene for the actual treatment to be done?
Yeah.
So if the patient is not willing to put in the effort and does not have the financial capacity to actually follow through with the treatment, then most likely the treatment that is now given to the patient is not what they now want because it doesn't match their pocket. But they still want some compromise to be done. But when it comes to vital tissue, it doesn't work with compromise. You have to have healthy tissue for treatment to be successful.
Because what he wanted, Brad, like it was like multifaceted. It was going probably even like a bone graft, then like crown lengthening and endo, post and core. Like those are like it was going to be expensive just to save that 127.
They don't see all the background work on social media. And they just expect that this is a tooth. Tooth is a tooth is a tooth is a tooth. And it can be saved. No. Different treatment plans for different individuals that present with different problems. So it's tailor-made. Yeah.
I feel like maybe some like some dentists that I follow on Instagram do have like not a disclaimer, but they like give you the full entire story. But then there are others who just give you like that before and then after, and it's like, yeah, but you didn't tell everybody the full story, and now everybody's going to expect that kind of treat, and then they come to us and they're going to say, I want this exactly, and then we'll be like, yeah,
but it's also not the dentist's fault on social media to advertise and give the details. That's why you go to your health practitioner for a consultation. So if you now get a consult and you choose to not listen,
that's not on anyone.
Then it's not on anyone.
That is true.
And for the dentist that did the filling anyway?
You ate that man.
The dentist that did the filling anyway, if a consent form was not signed or consent agreed, say for instance the patient decided to still do this regardless of being informed of the consequences, then it is an issue. Just to summarize it, if a patient wants a treatment done the treatment can still be done as long as the patient has been informed. So informed consent, when it comes to ethics, has different things that must be agreed upon for it to actually be a valid informed consent. So there is the ability to choose treatment, and when treatment is given, there should always also be the other side of it to say you don't have to do the treatment. So it's up to the patient to decide if they want treatment or not want treatment. But there's also everything in between. So if they still do not want the treatment that is discussed and best for them, and they still want to go for what was discussed, although it's very wrong, then the patient can be like, I still want this. And then the dentist says, okay, it's fine, but then sign this, and this is just literally the fact that I've informed you that it is not going to be successful, but if you still want to go for it, we can try it.
I will take your money.
Yeah.
I mean, they're going for something that you advise against.
You've been advised against, and you're still like, no, I want to jump down that bridge. Well, jump. Then that's what it is. You can either decide, yeah,
Each
sure,
one of us
jump.
is getting paid from this job.
Yeah. Or you'll be like, no, I'm not going to do that, and please leave the practice.
Yeah.
It's one of two. But if you've already spent all this time with this patient, and this patient is still being difficult, then you're like, okay, cool. I'll do it for you, but then, it's not going to work out. Just pay and go.
No, yeah, that's why I chose not to, because I don't think I'll be able to sleep at night knowing that I just...
You took his money?
Consultation money. He came for a consult.
Consult was given.
A consult was given, he refused my treatment, and I was like, okay, fine, you can go to the other dentist then with all pleasure, because I'm not going to do that. Tell like gold onlays on like little kids. Because I've had so many like pre-teens get angry at me because I wouldn't prepare like or get them the gold onlays, but it's like, no. Like 13, what are you going to do with the full gold on the front tooth? Wait until you're at least 16 to make bad decisions, not when you're 13. I actually had a couple that stormed out of the practice because I was so angry. Like, but I came here for gold. Like, yeah, but you're 13.
Yeah, look at your tantrum.
Yeah, exactly. And you're like 13 years old, what are you going to do with it? Oh, hold on. Once you're 16. Because everyone I've ever known who has had a gold onlay has regretted it like 10 years later. They want it out. So I tell people, especially like, don't do the front. Never do the full. Just go for the naturals. 'Cause, yeah.